Hello everyone, my name is Nausheen Parveen, Assistant Professor in IIMT College of Pharmacy, Greater Noida. In today's lecture, I am going to discuss about principle of toxicology. In today's lecture, I'm going to discuss about acute toxicity, subacute toxicity, chronic toxicity, genotoxicity, carcinogenicity, teratogenicity, and mutagenicity, and other topics. General principle of treatment of poisoning, clinical symptoms, and management of various poisoning conditions. First, acute toxicity. Definition of acute toxicity is it is a adverse effect of a substance that result either from a single exposure or from multiple exposure in a short period of time, usually less than 24 hours. To be described as acute toxicity, the adverse effect should be occur within 14 days of the administration of the substance. Measures of acute toxicity, regulatory values based on experimental data, American Conference of Governmental Industrial Hygiene, ACGIH, and other and the Occupational Safety and Health Administration OSHA set a standard value for acute toxicity. Experimental value. Various experiments are carried out to get reference value in the chemical industry, that is the median lethal dose or LD50. This is the concentration of substance which resulted in the death of 50% of test subjects, typically mice or rat in the laboratory, which will be considered as a standard value. Next is subacute toxicity. Definition is subacute toxicity is an adverse effect occurring as a result of repeated daily dosing of a chemical or exposure to the chemical over a period of several days or weeks. Acute toxicity studies are conducted as range finding study in order to choose dose level to be used in subsequent subchronic and chronic toxicity study. Subacute toxicity study may support initial clinical trial where the duration of treatment may be up to 4 weeks. Next is chronic toxicity, the development of adverse effect as a result of long-term exposure to a contaminants or other stressor is an important aspect of aquatic toxicity. Adverse effect associated with chronic toxicity can be directly lethal but are more commonly sublethal, including changes in growth, reproduction, or behavior. Chronic toxicity is an contrast to acute toxicity, which occur over a short period of time to higher concentration. Various toxicity tests can be performed to assess the chronic toxicity of different contaminants and usually last at least 10% of the organism's lifespan. Next is genotoxicity. What is genotoxicity? Genotoxicity is describe the chemical agent that damages the genetic information within the cell, causing mutation which may lead to cancer. Genotoxicity is a word used in genetic that describe the positions of substance that has destructive effects on the genetic material of the cell like DNA, RNA, thus affecting the integrity of the cell. Genotoxin are mutagens that can cause genotoxicity, leading to the damage of DNA or chromosomal material, thus causing mutation. Genotoxicity can induce chemical substance as well as radiation. Genetic toxicity is the branch of science that deal with the study of agent or substance that can damage the cell's DNA and chromosomes. It is noted that often genotoxicity is confused with mutagenicity. Next, genotoxins can be of the following category depending on its effects for carcinogen, mutagen, and teratogen. What is the carcinogen? Carcinogen, cancer causing agent. Mutagen is mutation causing agent. Teratogen is birth defect causing agents. First is carcinogenicity. Carcinogenicity is the ability or tendency of chemical to induce tumor like benign and malignant tumor, increase their incidence or malignancy, or shorten the time of tumor occurrence when it is inhaled, ingested, dermally applied, or injected. A few well-known carcinogens are asbestos, nickel, cadmium, radon, vinyl chloride, benzidine, and benzene. These carcinogens may act alone or with another carcinogen to increase your risk. For example, as asbestos workers who also smoke have a higher risk of lung cancer. Teratogenicity. A teratogen is an agent that can disturb the development of the embryo or fetus. Teratogens help the pregnancy or produce a congenital malformation like birth defect. Classes of teratogen include radiation, maternal infection, chemical and drugs. Example, fetal alcohol spectrum disorder. A baby born to a mother who drinks alcohol during pregnancy can have many problems. This is called fetal alcohol spectrum disorder. Fetal Hydantoin syndrome, baby born to a mother who took phenytoin has 5 in 100 to a 1 and 10 chance of having a birth defect. This birth defect is a combination of problem called fetal Hydantoin syndrome. Mutagenicity. Mutagenicity refers to a chemical or physical agent's capacity to cause mutation, genetic alteration, agents that damage DNA causing lesion that result in cell death or mutation are genotoxins. Next is general principle of treatment of poisoning. Poisoning is a commonly due to ingestion but can result from injection, inhalation, or exposure of body surface. Example, skin, eye, mucous membrane. Many commonly ingested non-food substances and are generally non-toxic. However, almost any substance can be toxic if ingested in excessive amount, causes toxicity and point. General measure for poisoning treatment. Drugs along with household and industrial chemical, insecticide, etc. are frequently involved in the poisonings. Specific antidotes such as receptor, antagonist, chelating agent, or specific antibodies are available for few poisons. General supportives and symptomatic treatment is all that can be done for others. And this is also important for poisons which have a selective antagonist. Next slide. The general detoxification and supportive measures are: first is resuscitation and maintenance of vital function. Second is termination of exposure like decontamination and ensure patient airway adequate ventilation. Third is prevention of absorption of ingested poisons. Fourth is hastening elimination, means fast removal. First, resuscitation and maintenance of vital function. Ensure patient airway adequate ventilation, give artificial respiration, 100% oxygen inhalation as needed. Second is maintain blood pressure and heartbeat by fluid and crystalloid infusion, pressure agent, cardiac stimulant, pacing, defibrillation, etc. as needed. Next is maintain body temperature. Next method, next function, maintain blood sugar level by dextrose infusion, especially in patient with altered sensorium. Next process is termination of exposure, means decontamination. They will perform by removing the patient to fresh air for inhaled poison, washing the skin and eyes for poison entering from the surface, induction of emesis with the help of EPK or gastric lavage for ingested poisons. Emesis should not be attempted in comatose or hemodynamically unstable patient, as well as for kerosene poisoning due to risk of aspiration into the lung. Contraindicated in corrosive and CNS stimulant poisoning. Emesis or gastric lavage is not recommended if the patient present more than 2 hours after ingesting the poison. If the poisons or a dose ingested are known to be non-life-threatening, or if the patient has vomited after consuming the poison. Next process is prevention of absorption of ingested poison. A suspension of 20 to 40 gram, 1 gram per kg of activated charcoal, which has large surface area and can absorb many chemicals, should be administered in 200 ml of water. However, strong acid and alkalis, metallic salt, iodine, cyanides, caustic, alcohol, hydrocarbon, and other organic solvents are not absorbed by charcoals. Charcoal should not be administered if there is paralytic illusions or intestinal obstruction, or when the patient reports more than 2 hours after ingesting the poison. Next process is hastening elimination of the poison by induces diuresis or altering urinary pH. Inducing diuresis, furosemide like mannitol, or altering urinary pH like alkalinization for acid drug, example is barbiturate and aspirin. However, excretion of many poison is not enhanced by forced diuresis, and this procedure is generally not employed now. Hemodialysis and hemoperfusion passes of blood through a column of charcoal or absorbent resin are more efficacious procedure. Next is barbiturate poisoning. Causes mostly suicidal, sometimes accidental. It is frequently encountered now due to inavailability of barbiturate. Sign and symptoms: due to excessive CNS depression, patient is flabby and comatose with sallow and paling, respiration fall in BP and cardiovascular collapse, renal shutdown, pulmonary complication, bullous eruption. Lethal dose depend on lipid solubility. It is 2 to 3 gram for more lipid solubility agent, short acting barbiturate, and 5 to 10 gram for less lipid soluble phenobarbital. Treatment: first we will do gastric cleavage. Gastric cleavage: leave a suspension of activated charcoal in the stomach to prevent absorption of the drug from the intestine. Next process: supportive measures such as patient airway, assisted respiration, oxygen, maintenance of blood volume by fluid infusion, and use of vasopressor. Dopamine may be preferred for its renal vasodilating action. Next process: alkaline diuresis with sodium bicarbonate, IV with or without mannitol is helpful only in case of long-acting barbiturates, which are eliminated primarily by renal excretion. And fourth process, hemodialysis and hemoperfusion through a column of activated charcoal or other absorbent is highly effective in removing long-acting as well as short-acting barbiturate. There is no specific antidotes for barbiturate. In the past, analeptic like metrazole, demiglides, etc. have been used in an attempt to awaken the patient. This is dangerous, may precipitate convulsion. Precipitate convulsions while the patient is still comatose. Mortality is increased. The emphasis now is one keeping the patient alive till the poison has been eliminated. Next drug is morphine poisoning. Causes: accidental, suicidal, or seen in drug abuser. In the non-tolerant adults, 50 mg of morphine IM produce serious toxicity. The human lethal dose is estimated to be about 250 mg. Next, sign and symptoms. Sign and symptoms are extension of pharmacological action, stupor or coma, flaccidity, sallow, and occasional breathing, cyanosis, point, people fall in BP, stroke, convulsion may be seen, pulmonary edema occur at terminal stage, death is due to respiratory failure. Next step is treatment. Pressure respiration also opposes pulmonary edema formation and maintenance of BP, IV fluids, vasoconstrictor. Gastric leakage should be done with potassium permanganate to remove unabsorbed drug. Leakage is indicate even when morphine has been injected. Being a basic drug, it is partition to the acid gastric juice, ionized there, and dose does not diffuse back into blood. A specific antidote is naloxone 0.4 to 0.8 mg IV repeated every 2 to 3 minutes till respiration pickup is the specific antagonist of choice because it acts rapidly, does not have any antagonist action and does not per second depress respiration. Due to short duration of action, naloxone should be repeated every 1 to 4 hours according to the response. Next drug is organophosphorus compound poisoning. Causes chronic organophosphate poisoning, repeated exposure to certain fluorine containing an trial organophosphate result in polynucleotides and demyelination after a latent period of day to week. Sign and symptom sensory distribution disturbance occur like muscles weakness, tenderness, and depressed tender reflexes, lower motor neurons, paralysis. In the second phase, epasticity and upper motor neurons paralysis gradually supervenes. Recovery may take years. The mechanism of this toxicity is not known, but it is not due to inhibition of chlorine chlorine esterase. There is no specific treatment. Next is mercury arsenic poisoning. Causes chronic repeat exposure of certain ions like mercury, arsenic containing compound is in industry or by accidental. Sign and symptoms common like poisoning condition, treatment, calcium, sodium, EDTA. 1 gram is diluted to 2 to 300 ml in saline and or glucose solution and infuse IV over 1 hour twice daily for 3 to 5 days. The urinary excretion of lead is promptly increased but decline quickly as the metal is removed from accessible site, primarily gold. A second occur of calcium sodium EDTA may be repeated after 5 to 7 days, allowing time for lead to redistribute to extracellular sites. And last type of poisoning and antidotes. First is barbiturate poisoning. Antidote is benzodiazepine antagonist, flumazenil. Morphine poisoning, naloxone. Organophosphorus compound poisoning, atropine. Cholinesterase reactivator, oxanes. Lead poisoning, EDTA chelating therapy. Mercury poisoning, BMPS, is an analog of British anti-leucides. Arsenic poisoning is dimercaprol and dimercaproltosuccinate. acid, succinic acid, and our chelating agent, supplemental potassium. These all are the poisoning and principle of poisoning and treatment. Thank you.